Okay, welcome everyone to our webinar today on children and COVID-19 and how you can keep your family safe during the pandemic. My name is Amy Anthony. I'm the Communications and Outreach Manager for the Hassenfeld Child Health Innovation Institute. Thanks so much for joining us today. The Hassenfeld Institute is a collaboration between Brown School of Public Health and the Warren Alpert Medical School of Brown University. And our mission is to make Rhode Island among the world's healthiest places for children. So I'm going to turn it over to our director, Dr. Patrick Vivier. He is the director and an executive committee member of the Hassenfeld Institute. He's also director of interdisciplinary education programs and professor of health services, policy, and practice in Brown School of Public Health. And he is professor of pediatrics and emergency medicine at the Alpert Medical School. So thanks, Patrick.
Thank you, Amy. Welcome, everyone. We're incredibly lucky to have two terrific experts, people that I like to go to for advice on pediatric issues. First, I'll introduce Dr. Penelope Dennehy, who is a professor of pediatrics at the Warren Alpert Medical School at Brown University and a member of the faculty of the Division of Pediatric Infectious Diseases at Hasbro Children's Hospital. Her primary area of research includes the study of viral gastroenteritis and viral respiratory diseases. Dr. Dennehy is a past president of the Pediatric Infectious Diseases Society and is a past secretary of the Infectious Disease Society of America. She served as a member of the American Academy of Pediatrics Committee on Infectious Diseases from 2003 to 2009. Dr. Adam Pallant is the clinical director of health services at Brown University. He's a board certified by the American Academy of Pediatrics. Previously, Dr. Pallant was the pediatric residency director at the Warren Alpert Medical School at Brown University and a primary care pediatrician at Hasbro Children's Hospital in Providence for 19 years. Dr. Pallant has a special interest in the intersection of mental health and physical health. And these are, as I said, two of my go-to people. So we encourage you all to submit questions. The focus is on COVID and children. You know, much of the discussion has been on adults. Thankfully, children have been affected a bit less than adults, quite a bit less than adults, but they're still really important issues. So to get us started, I'll ask Dr. Dennehy first. Are there symptoms of COVID-19 different in children when compared with adults? Is the disease similar between those two age groups, or are there important differences?
Well, I think the biggest important difference is the majority of children probably have very few, if any, symptoms. But when they do develop symptoms, their symptoms are similar to adults. They have can have fever and cough and occasionally shortness of breath. And rarely gastrointestinal symptoms like diarrhea or vomiting. But for the most part, most kids don't have many symptoms, if any.
Okay. And in terms of getting the disease, Dr. Pallant, are there things that families should be doing to try to prevent their child from getting COVID? What are the most important things that you're recommending as a way of not experiencing this?
Yeah. Thanks for having me. And honestly, nice to see everybody. I guess I can't see anybody, but nice to be speaking with everybody. You know, on some level, I'd like people to be thinking about what they already know in common sense. What we do know is that the more likely that your child is exposed to others who may have the disease, the more likely that they themselves will pick it up. The more capable we are of going through that hand washing routine, the much better we are at accidentally having a student or a child pick up the disease and pass it on themselves. But you'll hear from me across the entire seminar talking about that these are all, you know, shades of gray kind of concepts, and we'll all have to balance the benefits of being really cautious and perhaps the risks of being so cautious that we end up with a child in a bubble who's also struggling in a different way. So good common sense, social distancing, hand washing, but not to the point of obsession, if possible.
Great. And sort of in that, in terms of severity of disease, can you talk, Dr. Dennehy, a little bit about are children at risk for severe disease?
Yes, they are, but it's very rare. And I know there's a lot of concern, and parents may have seen on TV this rare multi-system inflammatory syndrome that is being described. And it's very scary for parents to hear this. I think what parents out there need to know is that it is quite rare, even though there were many, many children affected around the world. The number of cases around the world is still quite small. And this is not something that you would miss if this were happening to your child. But for the most part, most children don't require hospitalization, even if they become ill. And the few that we've had in the hospital here at Hasbro Children's Hospital have been mostly here for other reasons and happen to have tested positive for COVID. So they're not being, and we've not had anyone in our intensive care unit. So we are not seeing severe disease, unlike our adult medicine colleagues who have seen large numbers of adults who've required intensive care.
Can either Dr. Kennedy or both of you, can you talk a little bit, a specific question was submitted in advance of what are the signs and symptoms? Are there things that parents should be looking for in this inflammatory process that's happening related to COVID?
Sure. I just spent an hour and a half listening to a presentation from the Centers for Disease Control that went through this. So quite fresh in my mind. The things that would make me worry that a child had this is a persistent high fever, meaning 103, 104 area for 4 or more days. Most of these children who have this syndrome have severe abdominal pain. So really, really bad abdominal pain, like a 10 out of a 10 if you were rating it. And also the children may have some sort of a rash, but really the fever and abdominal pain are the things that you should, if your child were to develop that, would be the things that I think would tip you off to come into the hospital. Interestingly, these children don't have respiratory symptoms at all. So unlike our adult population, where many of these people develop shortness of breath, difficulty breathing, that's not what's happening to children. They generally are having high fevers, rashes sometimes, and severe abdominal pain.
Maybe I'll put a little bit of a different spin on that, although hopefully the spins go together, which is I don't think anyone's going to miss this. I don't think that if anybody's staying up at night with a flashlight next to the bed, checking on their child every 2 hours, you don't need to do that. This illness is not subtle. The children will be very, very sick if that would, I suspect any one of you would have brought your child to their healthcare provider for even less than this broad inflammatory syndrome is presenting as. And so while I don't want to say that it's not possible to happen, what I don't think people have to do is to be hyper vigilant and watch every minute, every night to see if it's going to happen. It's unlikely, highly unlikely, but if it is, you'll know. You'll know.
And most of the children who have this have not had classic COVID illness. They have illness that, or no illness, the majority of them. So this is a post, down the road from being infected, usually asymptomatically. So this is not something that we can do anything to prevent, because most of these children, we had no indication they were infected. And Dr. Pallant is absolutely right. This is not something that any parent would miss. You would be calling and bringing your child to the emergency room or to your doctor right away.
And sort of just to follow up on that a little bit, there was a specific question about whether children test positive before you see this inflammatory process. And from what you're saying, they probably were not sick, so they probably didn't have a test. Is that the correct answer?
Yeah, that's the correct answer, is the majority of these kids do not have a positive test ahead of time, because the great majority of them have had no symptoms whatsoever. And the reason we know that they've been exposed to COVID is that they have antibodies, which indicates that they had an infection weeks and weeks before, or their family had a infection that passed through the family that looked like COVID. So again, we don't understand much about this. It is extremely rare. Let me emphasize that, extremely rare. And we have not yet seen a case in Rhode Island. We've seen 3 children that look like they might have it, and none of the 3 have had it. So it's not something that we expect to see, maybe more than 1 or 2 children at most. So this is not something that you as a parent out there should really be very fearful about.
And in the event that any of you are thinking, well, should I get my child tested so I will know to watch for this? That would not be recommended. It won't, it's not necessary. It will only potentially even create worry. Again, this right now is more prevalent in the media than it is in any one of our experiences.
So getting away from just the inflammatory process, just back to COVID, I'll stay with you, Dr. Pallant. What does a parent do if they think their child has COVID? What are the ways that you respond if you think you have the infection?
Right. On some level, I'm thinking the first thing that you do is you have a good lineup of Netflix and Amazon distraction, because you're going to be in that house for a while, tightly in that house. Here's sort of the good news. The good news is that our experience is the overwhelming breadth of children who do have COVID are going to have minor symptoms or a bad cold and not much more. And while this may sound a little bit distracting, I'm almost perhaps more worried about their grandparents than I am about the children themselves. And so almost the first place I'm going to start is that while, yes, we should be very thoughtful, loving, and caring about everything that happens with our children, I don't want people to think or forget about the fact that they're perhaps the greatest risk is who are they going to give it to who could have severe disease, and not going to be the older individuals. In terms of what does one do, the bottom line right now is I'm hoping that everyone who has a child does have access to a primary care pediatrician or family practitioner, a provider, nurse practitioner. You call them and you together make the decision whether or not it's even pays to have the child tested or not. It may not. I do want to keep in mind that testing the child themselves doesn't necessarily change how you'll care for that child, but it will have bearing on the way you or others around that child could spread the disease. So have a conversation, keep the worry low, be prepared for the understanding that if either you or a child has COVID or was exposed to it, you're going to be asked to stay away from other people in a big way for 2 weeks. Get your popcorn, figure out what the television schedule is, because you're going to be in jail for a little while.
To play off that a little bit, maybe Dr. Denny can jump in. There are a couple questions about transmission and the issue of kid-to-kid transmission, as well as from adult to kid to adult. Dr. Pallant was bringing up the worry of older folks in the family. Can you just talk a little bit about transmission and this risk of transmission, either kid to adult to kid?
It's really hard to know because we're not testing everyone. So we really don't know. It seems not like flu where the kids are the major vectors. It appears that in the children that we're seeing in many cases, their parents are essential workers out in the community and maybe bringing it home to that family grouping. We don't really know how much transmission occurs child to child. And so that's one of the questions that remains to be answered. How infectious are children? We're not sure compared with adults. Certainly kids sneeze and cough less forcefully, so it's probably adults who are sneezing and coughing are spreading a greater field of virus out in front of them. But a lot of this are questions that remain to be answered. And so some of that is, there were a lot of questions that I think people were asking about opening schools, opening daycare centers. And I think as we learn more about this virus, our public health colleagues are going to be ones that are looking at this kind of data and trying to figure out is when and if it's safe to open childcare, schools, et cetera, as we learn more about transmission and who catches virus from whom. But I think we don't have a great, oops, sorry, my light went off. We're sitting too still for too long. We don't really know yet how infectious kids are compared with adults.
So a question to both of you. Actually, there are a couple of questions that come in have been around the newborn and infancy time period, thinking about when do you take them out to public settings? When is it okay to have daycare? What should you be doing in this younger age group, whether that's in the newborn period or the infancy period? What are the recommendations for parents of how they manage exposure in that younger age group?
You know, I very much wish I had a crystal clear answer for you. I don't. On some level, there will have to be some decision making from each family. You know, the general rule of thumb is to be perhaps more cautious than you would under ordinary circumstances. For other reasons, I might say for the first 2 months of life, one would want to be quite cautious in terms of exposing a newborn to something that can give them a fever for a variety of reasons, not because the fever is particularly dangerous, but understanding what the fever is coming from can be somewhat complex. You know, it falls into a category of all things being equal. We wouldn't want infants to get ill. The flip side is to have an infant that has almost no stimulation, or the reality, if they have brothers and sisters, the idea that nobody in the family should get near that newborn. It's not how it works in real life. And there does have to be some degree of balance. Penny, you know, Dr. Denny, your thoughts about that?
Yeah, I think, you know, we know that I've now seen several children here in the hospital who've developed fevers who were in that newborn age group because their parents also became ill and the baby acquired infection from the parents. These kids have done great other than having fevers and having to come into the hospital and get worked up for a fever because they were quite young. But I agree with Dr. Pallant, with Adam, that we should treat very young infants carefully because they don't, you know, in most cases, children acquire antibodies through the placenta from their moms, and they're protected against a lot of things in the first few months of life by those antibodies. But no moms have immunity to this virus. So, you know, the kids are more susceptible perhaps to this than other things. And I think it's wise to, you know, not take them out and about in the general community any more than you would have for any other reason, if it's flu season, if it's, you know, other respiratory viruses are around. I think you just are very careful with kids in the first couple months of life, as Adam said. And then, you know, beyond that, you can gradually take them places and whatever. But I think that it's really important to protect our very young infants, especially in, you know, keeping them from being exposed to a lot of adults. And given the general shutdown of what's been going on, I think most newborns are being mostly exposed to their family members.
And again, as you say, things are closed, but just to specifically answer the issue of daycare, any specific thoughts about the daycare, if they're even open and available? But
yeah. Well, I know that there's some daycares open for essential healthcare workers and other things. And the things that are being done in daycare that make sense to me is small groups, keeping kids together in the same groups, not mixing kids from group A with group B. You know, the staff being careful of washing hands and using appropriate cough etiquette, because kids can't, small kids can't. And so we have to protect them. And so some childcare has been open and using those rules. And I think they've been doing okay. I haven't heard of any outbreaks in childcare at all.
Either. I'm going to go so far as to say that Rhode Island, I actually think, is out ahead of this. And Governor Raimondo has come up with a plan that insists on childcare centers having a plan themselves in the process of reopening. I took a look at that paperwork, and I think it's very well thought out. I think it's going to be hard on parents because it's going to mean parents and adults aren't going to be able to go in and see the children, drop them off, give them a big hug as they go. It's going to be a little bit more of the drop and run kind of approach. So I think there will be some adjustment on everyone's behalf, but I do think that Rhode Island is very much a leader in understanding that childcare is going to be essential to helping people get back to normal lives, and they're thinking about hygiene, admixture of people who may be contaminated or infectious. Sounds weird, but I do think they're doing their very best to keep the numbers of students sort of small and in the same room. And again, I think what we have going in our favor is this doesn't always work this way, but by and large, children with COVID seem to be okay.
Mhm.
So let's go from daycare to the next set of questions are about school. And if we can sort of think of this, I think in a few different dimensions. One, for those who are going back to elementary school, middle school, high school, or college. Mentioned earlier, Dr. Pallant is located here at Brown. Talk a little bit about both that from a family perspective, things they should be thinking about, but also from a school accountability. What should parents be asking about or checking? Like some of this may be standard in the way that the governor's doing this for public schools in Rhode Island. But if we can think about the full age spectrum from elementary school or kindergarten all the way up through college, can we just talk a little bit about what parents should be doing and what kids should be doing and what they should be thinking about schools doing?
I'm going to go so far as to say that there's not going to be one answer to that, and that when the schools come up with one answer-ish, some parents are going to be very pleased and others are not. Let me give you the thought process. There's probably one end of the spectrum where parents may want every kid in a mask, never near more than 6 feet close to each other, washing hands every hour on the hour. And other parents who may say, you know, my child needs love and a hug and reassurance to get through the day. And so I kind of want to come out and start out by saying that I don't think there's going to be an answer that's going to give great confidence that everyone is going to be in the perfect zone. But I do think that there will be some sort of a middle road compromise where there will be good attention to hygiene, teaching how not to sneeze on somebody else's sandwich, how to keep a little more distance one from the other, how the teachers will be more attentive to keeping kids separate as need be. I do think parents, though, also going to have to be prepared for the fact that if and when their children are sick, they're going to be called on probably with a lower threshold than before to keep that child out of school and out of school for longer periods of time. So even as schools open up again, and even as there will be a gray zone of exactly what a school or a teacher or a classroom should look like, because we won't be able to satisfy everyone's wish because those wishes are different, I still think we have to be prepared for the likelihood that there will be more pressure on parents to keep kids who even have minor symptoms out.
Dr. Dennehy, you have any thoughts about?
Yeah, I think that, you know, there's going to be a much greater attention to hand washing, to social distancing. I don't know whether masks are going to be used in school. I don't know what the governor and the public health folks are thinking in terms of their plans for opening school, but that might be part of, at least for the older kids, especially when you're thinking about high school, junior high and high school age kids who may move from classroom to classroom. That's going to be a real challenge and to try and figure out how to deal with that. The elementary school kids, I think, are going to be in some ways a little easier in that they can be kept in a single classroom, and perhaps the numbers in a classroom are going to go down. That's probably going to be a good thing for learning, that there won't be 30 kids in a classroom. There'll be a smaller number. So I think a lot of the way we think about education in school is going to change. What I've found very interesting and what has been shared with me is that there are some kids who are doing really well with virtual learning, who were the kids who perhaps had some social anxiety, who were being bullied and whatever. So this downtime has not been bad for all children in terms of relationships. Some kids have blossomed in this time where they've had a chance to succeed in their studies without worrying about some of the social things that are going on. So I think there's a lot to think about schools, not only how to keep kids safe, but, you know, are we at a place where we're perhaps going to get a chance to develop some new models for learning?
I'll go to the other end of the spectrum. Again, I'm a college health provider right now, and what's happening in college health, I think, will give you an idea of how unsure the country is. California State University, which is the largest sort of public sector school, has decided that this fall there will be no classes. It will all be virtual. And as of today, Boston College and Notre Dame said we're open for business in the fall, send them all back. And so because we don't have distinct and clear guidelines, you're going to see different models. And I just think everybody should be ready for the fact that when you've seen one, you've seen one. It's going to be very little. It's going to be hard to wrap our heads around that there's going to be a distinct right way to do this.
Are there, sort of staying in your role as one of the people involved in those decisions at Brown University, are there at least minimal things or things that you think parents should just be aware of? It sounds like both of you are saying we're going to need a little more time. We need to hear what the experts and see how this unfolds. But staying with this college transition, or do you have any sort of minimal things that you think parents should be doing?
Yeah. I'm going to start off by saying make sure that all children have all the rest of their vaccines. I know that's not exactly what you were expecting for the answer, but you know, meningitis, which is fortunately very rare, we can protect you against. That doesn't go away just because COVID is here. All the other diseases, measles, they don't take a break just because we're dealing with COVID. So wherever you go to school, elementary through college, and I'm sure there's people on this who may disagree with me, but I'm going to go so far as to say not to forget the routine vaccines in healthcare that you need, because those requirements are still essential.
Dr. Dennehy, given your focus on immunizations in your career, I've got to at least give you a chance to echo that.
Yeah, fair enough.
Oh, I mean, it's extremely worrisome that we have seen a huge drop-off in children getting vaccinated around the country. And here in Rhode Island, where we had a really excellent track record for immunizations in our population. And the worst thing that could ever happen to us is to have a measles outbreak or pertussis or whooping cough outbreak on top of COVID. We just don't want to go there. So I encourage any parent who's on the line to make sure that your child is fully vaccinated, because that will help doctors distinguish if they are sick, that they're not sick with some other vaccine preventable disease that could start up because we now have a population that's not getting vaccinated the way they should.
So next up on the question is somewhat about transmission again. If you do have a child at home who has COVID, how do you handle your other children? And what is the sort of recommendations there for either of you would like to answer?
Well, I think if it's an adult in the family and they're sort of bringing it in from the outside, that person needs to be isolated from the rest of the family. Part of the problem is we don't know whether the other children are infected or not infected. So I think you just do good hand washing and make sure that people aren't sharing glasses, silverware, that kind of thing. The same kind of thing you do if your child had flu, severe flu, or anything else. It's a virus like all the other viruses. It makes its way from one person who's infected to another, usually on the hands. People rub their eyes, rub their noses. So you need to, educate if the kids are old enough to cough into your elbow, make sure if they're coughing, if they're not, at least washing their hands regularly for the ones who don't have the infection and the child that's infected, just so that surfaces don't get virus on them and somebody doesn't come along and pick them up and inoculate themselves.
And I may be going too deep, but I'm going to take a little bit of a deep dive down the rabbit hole here with the idea of what it means to be in quarantine and to have been around other people that have been infected. A question that comes up to me all the time from parents when I've unfortunately had to put their children into quarantine at Brown when they're feeling well is, why don't you just test them to see if they're going to get it? And the truth is that if you have been exposed to COVID, or if you've been exposed to coronavirus, and there's just a little bit sitting in you, perhaps that could develop into an infection, I can't find it. What I can't do is do any kind of test to say, well, you've been exposed and it's in you and you might get sick. The most we could do is to say that if you've gone from the day of exposure through 2 solid weeks and haven't gotten sick, you won't get sick from that exposure. It means you made it. Like, sorry, you were in jail for 2 weeks, but you didn't need to be, but thank you. It's a little bit of the truth of what we're facing. But part of what you'll be struggling with, and I think it's worth talking through a touch, is that if there has been an exposure that's been considered significant enough to you or anyone in your family has it, it will almost certainly mean, I don't want to say 100%, but almost certainly mean that all the people in your family will be expected to be inside your house for 2 solid weeks, even if you feel great. Because what we can't tell is, will you develop disease, and then as you're developing it, spread it to others and keep the chain going. So quarantine is something where that's the 2 weeks where we have to keep you away from everyone. And there is no testing that anyone can do to say, is that quarantine worth it or not?
Somewhat related to this is next question in terms of if a child has had a major exposure or been diagnosed with COVID, going forward, is it possible for them to transmit it later? You know, so this, I may be interpreting this beyond the sort of time where they're actively sick. Are they in the future potentially able to transmit it?
Do you, just so I have the questions, do you mean they've been exposed to somebody else, but they themselves have never been sick?
Well,
Or,
I think the question is if they've been exposed or actually had it. So I think the exposure question is probably assuming that they did get it.
okay.
I don't know if it's a question, it's not completely clear. Can you get it again, or can you be continuing to transmit it afterwards or in the future? Or are you, you don't have to worry, you can't give it to anybody ever again?
Yeah, I mean,
I think is what the question is.
There are a couple ways to answer that, actually. Children and adults who are infected probably shed virus that's infectious to others for 4, 5, 6 days. It depends on your age. Probably children shed a little bit longer than adults, but there's no evidence that people shed for very prolonged periods of time after they've gotten infected. But what's not clear is, are you protected from getting infected again? We do not know the answer to that. And that's the bazillion-dollar question that we would all like to know. If you've had COVID once, are you ever going to get it again?
yeah. With the CDC, yeah, with this,
Not answer that at the moment. And if that's what the question is, that's what the answer is to that at the moment.
I think that is the nature of the question. Yeah.
what the
Powell, you were going to
CDC
say?
Yeah, what the CDC is saying is that if you're 10 days past the beginning of your illness and you haven't been sick in the prior 3 days, you're not contagious anymore.
Yeah.
So the combination of 10 days past the onset of illness and at least 3 days of feeling yourself, that's a sign that you're no longer contagious.
Great. So then you're as safe as anybody else, but it's
Correct.
not a lifetime get out of jail free card that you could get COVID again and transmit it again, or at least we don't know that you can't. Is that what you're both saying?
We don't know that you can't, but
Yes.
you know, when they figure it out, that will be the top question that poses other problems, but we don't know that you can't. And I'm going to emphasize something because, you know, again, being in college, I've been around students who are saying, like, I'm going to do everything I can to get sick because that's my get out of jail free card. You know, I get sick, then I'm over it and I can go drink and hang out with my friends. And that's not the way to do it, friends. We don't know that you will be protected, and we don't want people intentionally getting sick as their way of saying, all right, been there, done that, now I can get back to my life.
Dr. Dennehy, did you want to add anything else onto that, or?
Yeah, no, I fully agree with Adam on that one. And this is again, the question that we really need answers to, because as we're looking at vaccine, and if we're looking at people who have antibody development post-infection, are you going to not get infected again? And if that's true, then vaccines are really a good possibility. If you can get infected over and over again, then vaccines are going to be really more problematic as to how to develop a vaccine that's really going to work.
Right.
Good. So I'm going to ask some very specific questions. People want to know, is it safe to take my kids to the park?
Oh, being outside is so much better if you can keep 6 feet of distance away from other families. fresh air and sunshine kill viruses. So it's a far safer place to be than in a small room with a lot of other people. So yes, I think, and it's healthy, and it's makes people feel good to get outside. So getting out for a walk, as long as your family unit is keeping a distance from other family units, is great. I would encourage it.
Right. We don't want 100 people on the swing at once. We don't. But we don't view that, you know, passing by someone at a 4-foot distance as you're walking, you're not going to get it that way.
So another specific question. Sorry, go ahead.
I should say 6 feet, not 4 feet.
6 feet. Got it. Grandparents. Visiting grandparents is the next specific question of parents where the grandparents from Florida or want to come and help with the 3-month-old baby, which we normally absolutely love when we can get such help and grandparent involvement. The question is, even if the grandparents are totally do all their precautions, masks and hand washing, should they be quarantined for 2 weeks before they're allowed to help take care of the 3-month-old? Or what are your recommendations, each of you there?
Well, I think the public health folks are leaning still toward if you come from somewhere else and you travel on a plane, or you've been traveling, you're at higher risk to have contracted the infection. And so they're still recommending the 14-day quarantine period. And the flip side of it is those grandparents are really the people at most risk for developing severe disease and really consequential disease for them. So I think families need to think about that part of the equation. They themselves may not be realizing that they have infection because they may be asymptomatic, but if that poor grandparent walks into that situation and acquires infection, they may become quite ill. So I think it's something that has to be weighed very carefully.
Yeah, that's a bi-directional exposure. Worrying about what the grandparents are bringing, or worry about you might give to the grandparents.
Exactly.
Now a specific question again about transmission of how long is in the field or in the air does the virus live?
Well, if somebody sneezes or coughs, there's evidence that the virus will stay in the air for about 8 to 10 minutes or so. On surfaces, it lasts longer, especially hard surfaces like metal countertops or something like that. It can last for at least, we can pick up viral particles. Whether that virus is live and infectious is less clear, but definitely probably for at least hours on those surfaces. So that's why people are recommended to wash their hands, because after you've touched things, you don't know what those surfaces have been exposed to. And so washing hands regularly, especially if you're handling things. Now, people get a little crazy on it. I've been asked lots of questions about the supermarket and what you have to do about your groceries and stuff. And I can honestly say that when I go to the grocery store, I do not put my bags on the counter. I put them on the floor. I take everything out carefully. I don't necessarily wipe everything down. But I also don't use things right away. And I wash my hands carefully after I've done that, and I throw the bags away. So I think people have gotten a little crazy on it, and I think there's not a ton of evidence that the virus is going to survive in your refrigerator for hours and hours and hours on a milk carton, for example. But certainly when you're handling something that somebody else has just handled, put in the bag for you, and you brought it home, letting it sit for a bit, washing your hands after you've moved it to another place is a good idea. Adam, you want to comment?
Yeah, no, there's actually a question coming up that I'm seeing that's, can your children catch the disease if they walk into a room that has the same air as a previous individual who was in there who was sick? And, well,
yeah, I can answer that actually from the point of view of measles. If I have measles and I'm in an exam room in a doctor's office and I leave, 3 or 4 hours later, there's still measles in the air. Measles is our most contagious virus. And if one person has it, about 10 people catch measles from every one person. This virus, we're looking at about 3 people who get it from one person who has it. And it doesn't survive in the air the same way. And it survives on surfaces for a period of time, but not for hours and hours and hours and hours.
And I mean, I'm going to even give the flip side, which is what I wouldn't want to have the concern that children should never go anywhere ever, right?
Right.
You know, if there's the chance that you would enter any room and perhaps someone else has been in that room who is sick, I'm equally concerned about the feel that children will have over time about how dangerous the world is by breathing, right? I think that that's not without some potential harm and risk in thought process too. Well, this is anecdotal. Again, at the university, we had 2 classrooms where somebody was positive and no other individuals in that classroom got ill, none, even though they were sitting in that same classroom for an hour. Not saying that you should be cavalier, but I don't think that you need to worry that it's so transmissible that, you know, if you step into a classroom where someone else had been in, that means you're gonna get it. No. So, you know, obviously some thoughtful caution is of value, but you know, Dr. Vivier mentioned that my area of interest is the overlap of, you know, physical, emotional, and emotional health. And I do think we should give a little bit of consideration to what we might be unintentionally doing with our children if we make them terrified of breathing, moving, touching. I hope we can all walk the fine line of being thoughtful, but also being a little courageous and still living to the best of our abilities.
So some of that, putting this into context, we do have the question of what is the current infection rate, if we know rates or death rate or numbers. Can we put this in, can you put some numbers around this? In the 0 to 18 is what the specific question was, or 0 to 21, wherever either of you want to weigh in on this.
Dr. Young, you go first.
Yeah. I think it's hard because we don't know, we're not testing everyone, so we really can't say the rate of infection is out of every 10 kids, 1 has gotten it, because we're just not testing in that way. But what we can say is that children, out of the number of cases that have been diagnosed in the United States, children only make up about 1 to 2% of that number of cases. So children just don't get infected, visibly infected, that often. We won't know those numbers until we actually are able to test large numbers of people who don't have symptoms and get some sense for the numbers of people who are infected.
Yeah, I do think you could make good inference, though, that while children can get infected, the numbers of those who end up being gravely ill are very, very low. And those that are gravely ill almost always, and I don't want to say every always, but almost always, also have other health impairing chronic conditions. So
actually, that's not true, Adam.
Okay.
It's the majority of kids who've gotten very sick have been healthy children,
Okay.
but the numbers are tiny. I think that's the message to send parents, those of you who are on the call, home with, is that the chance that your child will become sick enough to even need to go to the emergency room is incredibly rare with this virus. Right. Children, fortunately, just don't seem to be getting sick with this virus. I wish I could say the same thing. The age group that Adam deals with at the college age, they have a higher rate of getting sick, but it really ramps up and to the people who are 60 and over, and that's where the majority of people who are becoming quite ill are in those age groups, the older age groups.
Okay, next is one of the people participating has had experience with adolescents with quite different responses, from one who was hospitalized but didn't get terribly sick and now seems well, to one who had a very severe COVID toes and COVID hands and rashes, no energy, and is still 5 weeks out, having trouble. And the question is this being studied, or are people, I'm certain the answer is yes, but what are some early things that people are doing and looking at for this kind of broad range of symptoms that people and experiences with the COVID infection?
I think what we're doing is just trying to learn as much as we can, as fast as we can, about the broad spectrum of illness that this virus causes. It causes a huge spectrum of illness, much more so than a lot of the other viruses that we deal with. because it can cause gastrointestinal problems. It can cause pneumonia. It can cause other things. And so we're just learning, and the COVID toes are something we learned only a few weeks ago. So I think this is such a new virus. This is the first time it's infected people that we're just, we can't say with any clarity right at the moment that there aren't going to be other symptoms that appear over time as more people get infected. But at the moment, the majority of people who get sick get fever, cough, and shortness of breath in the adult population. And for kids, it's mostly fever and cough.
Yeah. And while none of us can say very much secure anything about COVID. But when I think of that, I also think about, I see mono every day in the college age population. And some people have almost no symptoms at all, and some people can be fatigued for some time afterward. And you would consider that, well, that's just, we can't exactly tell you why that particular individual had a longer course than another. But in and of itself, it doesn't make me feel that there's something peculiar about mono.
Right. So I'm noticing the time, and I want to make sure we get through each of the questions because it's gone by so quick. It's been wonderful to hear. I'll try to group them up. Some general questions about use of masks. So this one is specifically of should infants wear a mask with a hat with a plastic face covering for protection? Use of masks in general. Can each of you talk about that specific infant question of hats and plastic face covering or masks in general? What are your recommendations for
the infant question? I can handle. The mask question I may go back and forth with Dr. Dennehy, but kids under 2 are not. There is not the recommendation to cover them with masks. We don't want anything that can conceivably cover an infant's face. The risk of that is actually higher for other reasons. So masks under the age of 2 are not recommended.
That is true. And the other thing that people have to understand about masks are not protecting you from getting infected. That's not the purpose of masking. The purpose of masking is to prevent the person wearing the mask from spreading the infection by absorbing that. If they cough, sneeze, or actually even breathe heavily, you can spread virus. So if you put a mask on someone, that protects from doing that. And children don't generally cough, sneeze, or with great force. So they're not at huge risk for spreading the same way that an older child or an adult is. So remember that masking is really important to prevent you, if you're asymptomatic, from spreading infection to others. And that's why masking is recommended.
A question about so that COVID-19 has disproportionately impacted the Latino community in Rhode Island. Is there any data that we have around race ethnicity disparities in the pediatric age group for either positive COVID cases or hospitalization? Do we know anything for the pediatric age group around the Latino population or other health disparities?
Yeah, we do a little bit in terms of that severe multi-system inflammatory syndrome seems to have affected children who are Black or Latino more out of proportion to their percentage in the population. And that's true in Great Britain as well. So there may be some genetic components or other things. People are actively trying to study this to see. And some of it may be access to care and other disparities of care. So we haven't yet sorted out what is underlying susceptibility, genetically or otherwise, versus greater access to infection. So we know, for example, in Central Falls, the rate of infection is quite high, and that's also an area with a large Latino population. So is it true, and that they're related because of that? Or is the fact that there's a larger number of people infected because they're more susceptible from just whatever genetic background? So really not clear, really not clear.
Sorry, Dr. Powell, were you about to weigh in or
No, I don't have any additional information. Yeah.
There are still a couple more daycare questions in the difference between a group daycare versus individual daycare, and the specific question of would you put it off till September versus starting in June? I know we talked about daycare earlier, but there's a couple specific ones if either or both of you want to weigh in.
Um, that's a question that's layered with very many potential confounders, you know, including can you have your own daycare provider, and what's that personal daycare provider's access and communication with others, you know, so it might be hard to make a generalization. What I will go so far as to say is my suspicion, and Dr. Dennehy may agree or disagree, I'm not sure, my suspicion is that our experience with COVID in September, in my estimation, is not going to be wildly different than our experience now. Can I say that with security? No. But if there's not, if COVID is just spreading slowly and there is no vaccine available, I don't know that I would say that waiting until August or September is going to be the trick to making sure that daycares are going to be, you know, healthier than they would be in July. Just in terms of, you know, overall thought process, yes, the more people that you have contact with, the more potential there is for contagion. But, you know, whether or not you could have an au pair that lives in your house and never leaves compared to, you know, being in a group with 7 others, you know, that there are many pieces that go into that decision, and they need all to be considered.
Yeah, and I think some of it is going to come down to what the public health people in the state determine is safe. They are going to make some calls on daycare, I think, and the size of daycare, et cetera. But I think obviously the smaller the group of people that you're interacting with, as Adam pointed out, the less likely you are to get infected. So if you're going to have to choose between a large setting with many children versus an individual setting where you can have somebody come and care for your child individually, that's probably the safer route, just thinking about it in terms of the numbers of people that that child might be exposed to. That also means that the person coming into your house is somebody that you have to know what their circle is. So it gets a bit complicated. I know as a relatively new grandparent with a grandson in California, I've had this conversation with my son and daughter-in-law who've been able to work from home and have a nanny. And the nanny was about to leave as of May 1st, and my grandson was going to go to childcare, and that's been put on hold, largely by the state not opening the child cares, but also by their feeling that they were a little more comfortable having somebody that they know and trust coming into their home.
If we can stick to your grandparent reference, I know it was really more on the grandchild, but there was another grandparent question that I think ties into what you're both saying in terms of putting off the daycare, that the grandparents are in their 70s, wanted to come visit. The parents' sort of first thought was to put this off until Thanksgiving, but now questioning what might it be even worse than Thanksgiving. And again, their worry is about getting the grandparents sick. Do you, I know it's another timing question in grandparents, but do you want to weigh in a little bit on that, what your thought would be? Would you put off the grandparent visit? Would you, what would you think?
Well, you know, it's a very tough question. I've thought about it. When do I go to California to visit my grandson? Probably not for a while. And I think it's very difficult to do Zoom visits, but they're far safer at the moment until we're really quite comfortable with what is the transmission, especially if grandparents are coming from another area of the country where it's not clear what the transmission rate is in that area of the country. So I think we're just going to have to take a wait and see. That's my attitude. Public health folks are going to try and give us the best direction they can. And at this point, they're not encouraging that kind of visiting. They're not encouraging travel. They're not encouraging people going elsewhere to visit family members. And so I think we have to believe that those people have the best evidence and the best data and they're trying to operate in the best way possible to not to keep families apart, but to get families back together again when they can.
Great. We only have a few minutes left and there are a few questions. One is a big one that I know Dr. Pallant will want to answer. And that is, can you talk a little bit about mental health of children when managing this new way of life that we're all in? Dr. Pallant, I know that's a big focus for you.
And in 3 minutes,
We'll go over a couple minutes.
Yeah, yeah. I guess I'll try to do my best to summarize that there is a lot of anxiety and uncertainty out there, and I think this can also be a time where families and children can actually grow stronger as an outcome of this. And I think what children mostly need to know is we're here together, they're loved, they're protected, and while we don't know what is going to happen every day, every moment, what the future may bring, we're okay. We're okay. You're okay. And we'll get through this together. And what can we do that's fun now? Not every moment of the day. You still have to clean your room and do your homework. You know, don't get me wrong. But my hope and wish is that families and children will still continue with what routine makes people feel like life is normal. Some limits to behavior, those don't change in a pandemic, but laced with lots and lots of love and reassurance that when we don't have the security of what everything will be happening, we're resilient, we're okay. We have each other and we still like brownies.
Great. So I'll go through these next kind of quickly. Dr. Denny, do you want to weigh in? Could a whole family have be asymptomatic? I'm assuming that the whole family get asymptomatic infection where everybody's had it, but no symptoms.
Certainly think so.
Dr. Pallant, any thoughts about children with asthma? Any special concerns? Obviously, either can weigh in, but we'll start off with you.
No, again, the answer is going to be more generic, which is look at your child. You know,
Right.
Try not to have, with all your children, do that balance of trying not to allow your child to get unnecessarily exposed. But if they are, or if they've been around, your child will be your guide. If they're sick, you call your doctor, and if they don't have problems, you be the parent that you always were.
So no.
We've seen a couple of kids with asthma in the hospital that have COVID. And what seems to be happening is they're not getting any sicker with their asthma. It's just taking a little longer for them to get better. So I think
sorry, go ahead.
They need that. So the family really needs to work with their primary care doctor and work with making sure that child's on appropriate medications, et cetera.
Okay. A question for situations where parents are not living with their children, do you think it's safe to be visiting them?
I think, again, it's that balance that every family have to come to, the impact on the overall emotional well-being versus the risk of the health. Because I don't know the specifics, but I would imagine, depending on the age and circumstance, that kids need to see their parents and know that their parents are okay and that everything is going to be okay. If that can be done from a distance quite comfortably, I would entertain that idea. But I also think that you have to strike that balance between potential risk of disease, but potential risk of distress by not seeing your child or child not seeing your parent.
Okay. And I'll start with you, Dr. Denny, for this next one, but I'd like you each weigh in. It's our last question. Should we be concerned about the nation beginning to open up travel and loosen restrictions? How worried are each of you? I'll start with you, Dr. Denny. Sorry.
Tough question. I think it depends on what people do when we open up. Do people behave responsibly or do people behave irresponsibly? I think if we all go out and behave responsibly, then we can do it safely. And I think our governor actually has been saying that very clearly. If we take baby steps, we assess, we make sure that we're not getting ourselves into trouble. We're not seeing a big rise in cases. We're not seeing a number of people end up in our emergency room. Then we can open up a little more. And I feel very comfortable with that approach. The slow and steady, check on where we are and the way we are going. What bothers me is the pictures from Wisconsin where everybody went out to the bar and hung out together and started drinking and whatever. That's a sure place where disaster may happen with a lot of cases down the road. So I think it's responsible behavior.
And I'll chime in by saying I have great faith in people like Dr. Dennehy and in our public health system. And the reason I say that is we will probably have fits and starts. We'll start down one path and we may have to reel back a little bit. My only concern is that that might be a window of time where people might, say those idiots, they didn't know what they were doing. Why should I trust them? And I urge people to understand that we're taking one step forward, two steps forward. There may be a step back, but that doesn't mean that there was a grave error made and we shouldn't trust anymore. So I hope that we'll continue to keep our eyes and ears open to the guidance of people who really are truly looking out for our best interest.
Terrific. Well, the last one that flashed up was a thank you to our panelists for a really informative session, and I want to offer that thanks as well. I was excited to have both of you here, knowing you would give sage advice to folks out there, and you've done that, and we're very grateful that you've done it. I also want to thank Amy Anthony, who from our Hasselfeld Institute, who's organized this, and Hannah and the other folks from Media Services at Brown. Thank you also said we hope we'll do more of these. We are planning on doing more of these. For those in the audience, if there are topics in maternal and child health that you would like us to have this Ask the Experts, please reach out. Thank you, everybody.
Yes, thank you, everyone. Thanks to the panelists and to Patrick. And we are recording this, and so we'll be sharing it with everyone who registered within the next week or so. So thanks, everyone, for joining us today. Hope it was helpful.